Anxiety, it is part of the normal human experience, and a lot of kids have normal anxiety from transitions like starting a new school or moving to a new city. So it's when it's excessive and starting to affect everyday life and daily activities and your relationships with other people that we really need to intervene as parents and as primary care providers.
I'm really excited about this month because we are going to talk about pediatric anxiety, which is such an important topic. I know it's impacting not just the kiddos, but us parents too. Let's start with introducing our guest speaker today. I'm really excited to get to know Dr. Hung a little bit more. Dr. Hung, do you mind just saying a quick hello so that everyone has a face to the name there?
Hi, my name is Dr. Hung. It is a pleasure to be here this Saturday morning with you two lovely ladies.
Thank you. Thank you. So Dr. Jean Hung is a licensed naturopathic primary care physician and completed a 2-year CNME accredited pediatric residency at the Kids Clinic. She also has additional training with the Institute of Functional Medicine. She has had a lifelong passion working with kids, announcing to her own doctor as an 8-year-old that she's going to grow up to be a pediatrician, and her heart has been set since. Dr. Hung specializes in pediatric care from the newborn period to adolescence. She also works with children who have asthma, allergies, eczema, anxiety, depression, gastrointestinal conditions, autoimmune conditions, ADHD, and autism. Dr. Hung is certified as a Centers of Excellence provider and can evaluate and diagnose autism spectrum disorder in young children, as well as for developmental disabilities administration eligibility. She combines up-to-date standards of care from conventional medicine with evidence-based integrative medicine to develop comprehensive treatment plans that address the unique needs of each child and their family. Dr. Hung completed her undergraduate studies in psychology and microbiology at the University of Washington. She graduated from medical school at Bastyr University and received her doctorate in 2016. She completed additional rotations at Seattle Children's Hospital, Country Doctor, Neighbor Care Health, Health Point, Mary's Place, which services for homeless women and children, and numerous other pediatric clinics. Dr. Hung serves on the board of directors of PED-AMP and is a professional member of WANP, Integrative Medicine for the Underserved, and the Institute of Functional Medicine. Outside of the clinic, her passions lie in long-distance running, badminton, tea tasting, and board games. Well, it's an honor to have you here. And I also want you to know, actually, Dr. Gordon, you can add in too. So where is she working now?
So she has been a part of Flourish Valley Medicine for 2.5 years.
Correct. 2.5 years.
Yeah. Yes. And it is my absolute pleasure to have her. Patients love her. She's such a great asset. And so she was perfect to have as our guest speaker for this, because this is something that both of us see on a day-to-day when it comes to clinic and practice. And she's an amazing badminton player too.
Thank you. So thank you for the warm introductions. I'm really happy to be talking about anxiety because I see it all the time. In fact, I just had a new patient that I saw this morning, a 15-year-old that's dealing with significant anxiety. So in mental health, anxiety disorders are the most common, with an onset happening in childhood. At some point, anxiety is in effect up to 30% of all children and teenagers. And yet about 80% never get any help. Untreated anxiety disorders, they're linked to depression, they're linked to school failure, a 2-fold increase in substance abuse disorder. Part of it is I also want to normalize that anxiety, it is part of the normal human experience. And a lot of kids have normal anxiety from transitions like starting a new school or moving to a new city. So it's when it's excessive and starting to affect everyday life and daily activities and your relationships with other people that we really need to intervene as parents and as primary care providers. So by definition, a generalized anxiety disorder is, excessive anxiety and worry occurring more days than not. So at least more than half of the week, for at least 6 months. There are specific symptoms and a criteria we used, and the presence of any one of these symptoms in a child is almost enough to qualify, for an anxiety disorder. So symptoms on this list include restlessness, feeling keyed up or on edge, being easily fatigued, difficulty concentrating or your mind just kind of going blank, irritability, muscle tension, not being able to sleep. So any sort of sleep disturbance. The worry and anxiety, it causes distress or impairment in a social setting, in a school setting, in a job or occupation, or just other areas of functioning. And then we also need to make sure that these symptoms are not because of, drugs or because of caffeine or a medication or another medical condition like hyperthyroidism. So as primary care providers, we're screening for all the other things that it could be. Once we rule those out, we can be very confident, is this anxiety or not? There's different types of anxiety that I see in children, from generalized to social anxiety. So fear of going to school or fear of being in social settings, meeting new people, panic disorder, specific phobias, like specific fears of either crowded places or, dark rooms, or fear of heights, or, fear of the dark, scary animals, things like that. Separation anxiety, I see very commonly in my younger kiddos, separation from, parents, from both parents, or specifically, just mom or just dad. Anxiety can manifest in lots of other physical symptoms, so I hear teenagers telling me, like, I feel that my heart is beating out of my chest. Feel as though it's hard to take a deep breath in, feeling dizzy, the muscle aches, the stomach pain, headaches, literally feeling shaky and sweaty. So these are all physical symptoms. We call them panic somatic anxiety disorder, where the mental emotional is starting to cause physical symptoms. So parents have shared stories with me about how their kids act when they're super anxious. And I have moms who can't go into a different room of their house without their 5-year-old attached to them on the hip because they're too worried about where they are at all times. So imagine trying to go to the grocery store or having some free time for themselves. That's really challenging. I have probably one of the worst cases I've seen is I had a 4-year-old that I was actually afraid of dying. I don't know how this came up, but mom was super concerned. He was afraid of his mother dying. He was scared to go outside. He couldn't play next to a fence because he thought that any moment the fence would collapse on him. He was scared to go into car rides because he feared that, somebody else would drive too fast and hit them and then, hurt his whole family. So it really breaks my heart to hear these stories from parents. So as a primary care provider, I want to provide whatever support I can, especially during these early years. Like, what do we do with anxiety for a 3-year-old or a 4-year-old or 5-year-old? What resources can we provide these families? And that's a lot of the things we're going to be talking about today. So in terms of screening, it is a questionnaire when any parent, discusses, I think my child has anxiety. Can we talk more about this? The questionnaire I use is called SCARED. That's the acronym. It stands for Screen for Childhood Anxiety Related Disorders. It's age appropriately for 8 to 18-year-olds. It's a very simple 1 to 2 page questionnaire I give for the kids to fill out and for the parents to fill out. That's just kind of objective information. Screening is so important because it's used to not only measure, is there anxiety present? But it also helps us to rule out other mood disorders, things like depression or OCD or PTSD or potential learning disorders or behavioral disorders, conduct disorders. And also it's helpful to us as practitioners to see change over time if we do start a treatment or intervention, rather than just asking, hey, do you feel like you're less worried, to the 4-year-old or 5-year-old or to the parent or to the 8-year-old. We have some objective information to see if what we're doing is making a positive difference. As a primary care provider, I feel pretty confident in diagnosing most cases of anxiety after having a good conversation with the parents, getting a good history, doing my questionnaires, kind of talking with the kiddo and seeing how they are in the room with mom, just my interactions with them during the visit. There are some cases where it gets more complex, and Dr. Gordon is going to speak more about this as a parent, where a more comprehensive neuropsych evaluation might be needed from a psychiatrist or a psychologist for those kind of more complex situations where there might be, yes, also depression and OCD and maybe also learning disability. So I think she's going to share a little bit more about her own experience as a parent.
So I think one of the biggest things to try to get across in some of these discussions is both the clinical side that we see as providers, but then also the parent side as well. And so these are the things that we can say, if you're noticing things in your own kids, even if you're not patients here at either Nourish with Dr. Stewart and her practice or here at Flourish Family Medicine, that you have these questions that you can go to your own healthcare provider with to say, hey, I'm noticing this. Would this be could we do additional evaluations? Or I heard that there's this questionnaire. So what Dr. Hung was pointing to was that there's something called neurodevelopmental testing. And so this is something that is done by a psychiatrist, and it's different from what can be done in a school setting. And so oftentimes, if either the teachers are noticing either delays in learning, maybe being behind in some of the reading or math, or having a hard time concentrating, or just seeming like there is things that are interfering with learning, that it may be recommended to seek outside sources. So oftentimes in early education, whether it's preschool, kindergarten, it might be a visit to either an OT, PT, speech type evaluation. Whereas when they get older, then it's more of like a neurodevelopmental. So this is something that I have experienced previously, or I have experienced currently, I should say, and had experienced some of the other things prior to. But neurodevelopmental testing, it's a 3-part series. So it's a little bit not overwhelming, but it's a lot. It's an intense process. And it's extremely beneficial for those kids who are just not quite either seeing progress or that it is affecting so many different aspects of somebody's life. So for me as a parent, what we were noticing in my son Carter is that he was initially having a hard time with some of his letters and then reading. And then it turned into more of an anxiety type picture, because every time we would try to work with him, or we as parents would get frustrated that what we were doing wasn't working, he would shut down, and it turned into, tears. He didn't want to do any of his work. He started really not liking school. So it was cascading into signs of anxiety. So initially, when we brought it up with his teachers, they were saying, no, this is very common, especially as a boy. Sometimes they're just a little bit behind. They're going to catch up. But I knew as a parent that there was something that was interfering. And so I had to be a really big advocate for him to be able to push through and say, this is something that I want to have done. And that's what I would encourage any of our parent members to do, is that if you feel like there is either something that your primary care provider is not missing or is not taking seriously, or that your kids' teachers are not taking seriously, to push through and ask for some of these things. So that neurodevelopmental testing is a 3-part series. It is first an intake to kind of get to know what is happening that kind of prompted the need for this type of evaluation. And then the actual...
Sorry to interrupt you real quick.
Yeah.
So where would they go to do this evaluation?
So this is done by a psychiatrist. So you would have to, or a psychologist, you would have to either schedule your own as a parent, or depending on insurance, might need a referral. So here at our office, we have a list of resources of local providers that will do this type of evaluation.
Okay, thank you.
Yeah. So then the actual evaluation portion of it is several hours. It can be from 3 to 6 hours, depending on how long the kiddo needs, and in order for them to get the information that they need. And then you have a follow-up appointment to be able to go through all the information. Why these things might be important is because it's not just diagnosing, anxiety or depression. It can diagnose things like dyslexia, dysgraphia. So they're looking at how are they gripping their pens? Is there something to where they're having a hard time getting their thoughts that are in their brain out onto a paper? So if they're struggling with writing, and so it helps to either form an IEP, or it helps to form a 504, or some type of intervention in a school setting, or just simply as parents provide us additional resources to be able to say, okay, here's the why. Now we can understand why we're seeing whatever struggles in our kiddos. And so the reason I bring this up in here versus more of like a developmental delay or a topic around learning disabilities or things like that is because sometimes anxieties can be a symptom of something else, or it can be progressive and cause other things to happen. So making sure that as parents that we are being advocates for our kids, and not being afraid to ask, because sometimes it's hard to to speak up to a healthcare provider or a teacher when we feel like they might need to, or they know exactly what should be happening.
As a mom myself, how is this process taken by the kids? So, because I could imagine, a common question would be, well, I'm scared to do that because I don't want my kids to think that something's wrong with them to do this type of evaluation. So this question's for either one of you or both.
No, so great question, because this is something that I experienced firsthand, because part of what we noticed in my son was that every time we would bring something up, he felt like, so at first he was recommended to do summer school, and he took it as a punishment of, I'm not good enough, and now I have to do more school because I didn't do good the first time. So which further, triggered that anxiety picture. So we chose to be really open and honest with him, to be able to say, we want to do this test to be able to see how your brain is processing information, so that way we can help you the way that your brain wants to learn. And so we were just open and explained that it wasn't because he wasn't good enough or that he wasn't doing a good job or any of those things. Sorry, I get emotional about it because it is tricky as a parent to help to try to navigate all of these things. So yeah, be honest about it.
I really appreciate that, because it takes it less of like the burden it's on the kid. It's like, hey, how can we help you?
Yeah.
Help us. How can we do a better job? Because it's not one size fits all. So it seems, the way you just explained it seemed like, hey, we can customize this. We can customize your experience, which is so empowering and doesn't have that like kind of stigma of like, something's wrong with you. What's wrong with your brain? It's more like, hey, we collectively are in this together.
Yes, exactly. Dr. Hung, do you have ways that you explain to your patients when there is either a need to do some of these questionnaires or things like that? Because we will oftentimes get asked, like, why do you want me to fill this out? Or what is this about? Both from the parents as well as the kids. Do you have a way that you like to explain it?
Typically, parents are the ones that, bring up the issues to me. One thing I do want to discuss about like the business I have with the parents is that, the EHR, we use parents can message questions very, directly and confidentially to the providers. So I have parents who, before their wellness exams, will say, hey, I have something I want to talk with you about without my child in the room. So I also want to for parents to know that that's an option, that, the child does not have to be in the room for any of these conversations. They can be in another room coloring or playing or doing something else while we have these conversations, because some kids are going to be oversensitive to what their parents might be talking about. And so I actually prefer just talking to the parent for a lot of this, so that it doesn't feel like, oh, they're talking about me. Did I do something bad? Did I do something wrong? Because I never want kids to feel that way. And I would say that I normalize it just like Dr. Gordon does, that, anxiety or, depression, these are normal human experiences. We all feel these. I feel these, your parents feel. For some people, the feelings, we feel it all the time. And we're just trying to do everything we can to help you. We're a team, and we just want to support you so that you can go out and have fun with your friends, that you can go to school and, be happy because you have all these resources around you to make you successful. Like, just that end goal, we want you to be successful. That's why we're doing this. There's no other reason.
Going back to saying that it is normal to have anxieties. It's normal to have these experiences that make us feel these ways where we're like, I don't know if I should be feeling this way, or I'm feeling upset, or I'm feeling scared about this. And being able to differentiate between, is this a situational anxiety or a moment of like, I don't know how to handle this, versus is this an ongoing problem? And we address those two things differently.
Anyway, so just to share kind of a story that came up that was situational. My daughter kind of told me that how she didn't eat at school. And I was like, oh, well, why? And she said, well, I guess now the kids are teasing each other about if they have a runny nose or any potential symptoms of COVID. They kind of tease each other and say, oh, you have COVID, like with the simplest things. And so she said because I think she went to blow her nose, and then they immediately started teasing her that she has COVID. And so then she didn't want to blow her nose anymore. So she just under her mask would just have her let her nose just run. And then she didn't want to take her mask off over lunch to eat because all the other kids would see that her nose was running. And it just broke my heart because I was like, oh my goodness, like I didn't realize that I didn't even think that could be something that, kids can bully each other about now. And so, I talked to the teacher and said, hey, just want you to know this is, what's up and that this is real. And, for me, like I said, normally my kids don't really experience much anxiety, which I feel very blessed with. But these things, even with that, life can be challenging and these things can come up. So that was something that, preparing for today's webinar, that I thought, oh gosh, yeah, no, I'm definitely experiencing this with my girls.
Yeah. And so thank you for sharing, because that's an important example of how we can address anxiety without, going down this cascade of like, okay, now, because sometimes parents are like, oh my gosh, now I need to do something about this because it's also going to progress into something else. And so having some situational or things that we can do situationally when it's not something that is every single day that needs to be addressed, as Dr. Hung was mentioning, of when it starts affecting other aspects of our life. And so these can be times where we either come up with, a mantra, or we teach them these coping strategies of saying like, okay, nope, you literally physically or just in your head brush things off, or say, nope, that does not serve me, or things like that. And we'll chat a little bit more about these things at the end, but we wanted this topic to make sure that we covered all facets, the situational, maybe one time versus this is happening more often every day. So I think where we left off before I got emotional was talking about, when there's not only need for evaluations or referrals, but also, as Dr. Hung was mentioning, is making sure that we are ruling out some of those underlying factors. And so one thing that I would encourage every patient to do, again, being advocates, is making sure that we have done some lab work when it's necessary. Is it necessary all the time? No, probably not. But I think that there's a significant number of times where it is beneficial, and so the labs that we would sometimes recommend ordering would be a CBC, because we're looking at the red and the white blood cells, mostly looking for anemia, because that can play a really big role when it comes to mood. We look at ferritin, which is another way to look for anemia or low iron stores. We also look at thyroid function, so a TSH, free T3, free T4, and then also vitamin D. I'll also talk about other laboratory testing a little bit later, but those are some of like our basic screening things that we can do.
Hi, I'm Tina. So I have 3 kiddos, and I actually struggle with anxiety myself, which has only recently that I've been able to learn about in myself, which has helped immensely then recognizing some of the things that my daughter goes through. So we're kind of learning about this together. But one of the things that she struggles with, and Dr. Gordon, I think you had commented back of the question I put on the Facebook group, we discovered her anxiety comes out through stomach aches. And she's had a couple now within the last year. And only one of the 3 were we able to pinpoint, well, there was an actual instance that was bothering her, and we didn't figure out what it was for days later, and come to find out, like, she just wasn't asking the questions, and she thought we were going to be doing something else and thought it was going to be significantly different than the situation, and she was worried about it. And so we've worked through all that, but then what we've come to learn is she'll get her stomach ache now, even like delayed. One was over a science quiz that she thought she was ready for, and she wasn't, and she thought about that all morning. And then I got a call in the afternoon of, Elsie's had a stomach ache all day and she sounds awful on the phone. And, well, did you already have your test? Yeah, I'm not worried about anything. But it lasted for hours and I felt for her. So I guess my question is, now that we're able to kind of recognize what some of her triggers are, what do you do when the trigger has already happened? How do I've helped explain to her, what it is that she's feeling is normal. I get it. And so she understands, and she's like, why won't it just go away? I'm fine. I'm not worried. What do I do?
I think for this type of situation, I love using herbs. I love using herbs that have nervines, and gentle nervines, depending on how old your daughter is, work really well for this younger elementary school age population. My favorite herb, something that has lemon balm in it. So lemon balm has a huge digestive affinity as well as this calming, relaxing property to it. I guess that's one of the, when I think about like stomach ache and this kind of residual, I think about, a restless nervous system. And we think about the nervous system of our gut and the nervous system of our brains, and they're separate, yet they're extremely connected. I think, how can I support her digestion using some of these really calm, safe, nervine herbs? And then Dr. Gordon, what were you going to?
Exactly.
Before you go, I'm curious as far as the lemon balm. Would it be efficacious to take it in the morning before school? So if she sees a theme that this, especially occurs, at school, what is a good timing? How does that work with regards to taking some of these herbs to school? I don't know what it's like there in Washington, but if you could speak on like the practicality of doing that.
Yeah. No, great question. So yes, you can use them as like a preventative type thing. Sometimes it kind of depends on what it is. So if you know that she's going to be anxious about an upcoming test, maybe doing something the morning of to hopefully help to calm the nerves so that way the tummy ache doesn't happen later. So I agree, lemon balm is one of my absolute most favorite things. So I will oftentimes recommend doing a tea if we're doing it in the morning, or maybe you pack it in a thermos, because that would be a way that you could take it to school without having to get out something like a tincture bottle. So here's one of my favorites. So Melissa glycerites, which is lemon balm. This one is an alcohol-free extraction. So it's a little dropper that you can just drop a few drops in their mouth, or you can put it in some warm water, or you can put it in some tea. So I use this one a lot. Or you can take I'll use it for teething too, different totally thing, but in terms of like herbal popsicles. So sometimes depending on the age, if it's a younger kiddo and they're not big fans of drinking a tea, make a cup of tea that maybe has some chamomile, lemon balm, and then turn it into a popsicle, because then it's kind of a calming pop. Maybe you put them in the bathtub and let them eat a popsicle in the bathtub. So there's a few of those types of things where we can get creative depending on the age. So that's one of my favorites to help with kind of upset tummies, whether it's the tea that has fennel, chamomile, sometimes catnip can be a good one, Melissa. The other one I'll use, and we might even chat about this one a little bit later, but Rescue Remedy. So this one's a kid's one. This one is also a dropper, but they make it in little pastels, which are like lozenges. So depending on the age, sometimes if I know that it is a kiddo that has test anxiety and I'm comfortable with them having a lozenge away from adults, then I'll say, put it in your lunchbox. They don't know that it's a herbal thing instead of a candy treat. So there's a few of those types of things that we might recommend. But I think the Melissa is an absolutely fantastic go-to for that. And I think it's important to acknowledge that that is probably one of the most common symptoms that we'll see when it comes to anxiety, especially in kids when they aren't able to vocalize that they're feeling nervous or upset or anxious about something.
Is Melissa in the tummy tonic? And are you, sorry if I'm jumping ahead, but no, I know that's one of your favorite blends too. And I've definitely used that one as well. So that might be something, but yeah, it's just, to me, a part of me is like Starburst and all these red dyes and all these chemicals. That's totally fine. But we had to like hide in the,
I know.
hide in the herbs, whatever. We'll just do it. But it is true. So we don't have to involve the whole nurse and to have a huge discussion about it. It's just as kind of an example of food as medicine.
Yep. I agree. Or I love the idea of like a tea, especially for an older kiddo, to where they can easily pack it in their thermos and no one's going to think twice about that at all.
As naturopathic physicians, we always start with the foundations. So foundations of health first. So one, spend time in nature however you can. There's research. There's actually huge bodies of evidence of research that green space, just spending time outdoors, it boosts cognitive functioning in children. It promotes resilience against stress, against adversity, and against anxiety. So spending time outdoors. We're in the beautiful Pacific Northwest, but I know as the weather gets cold, it's hard. You don't want to go outside, but just making the time for a 15-minute walk to the park or, doing something outdoors every day, even if the weather isn't perfect. Adequate sleep. So making sure that depending on the age, getting 8 or 9 or 11 hours of sleep minimum. I do use, melatonin as needed if there is difficulty with initiation of sleep. Magnesium is one of the supplements we're going to talk about. That's great for kind of relaxing muscles and also helping transitioning to more restful sleep. So I'll use melatonin in a few kids as well, and it's quite safe. We just have to talk about and be mindful of potential side effects, like they might wake up really drowsy or they might have really vivid dreams or nightmares. So just knowing that there's also potential side effects for even a lot of the natural things that we do use. Addressing nutritional deficiencies. So Dr. Gordon talked on, checking iron levels, making sure kids are not anemic. Those are pretty easy fixes with a vitamin D supplement. If there's low vitamin D, or an iron supplement if kids are anemic or have low ferritin, low iron stores, and this adequate nutrition. So, we need protein in order to make neurotransmitters, the hormones of the brain. They communicate how we feel. So we need protein in order to build those brain chemicals. We need adequate micronutrients from our fruits and veggies. The reason why we recommend magnesium so much is because 50 to 60% of the US population does not get enough magnesium from their food. So as basic as that sounds, just eating a variety of fruits and veggies and getting enough nutrients from food. And then of course, just having a safe space. So having a safe, loving environment at home, making sure the parents also feel well supported. I can't emphasize how important it is for kids with anxiety to make sure that they can look for their parents, as these role models, these people they can always go to talk to about anything. We just want to make sure our parents are also taking care of themselves and having that self-care.
Yeah. I'm going to add something to that really quick before you move on. The other thing that I see really commonly, and I've experienced in my house as well, is that sometimes when kiddos are really anxious or they are overwhelmed or things like that, they can hold it together at school. They can hold it together at their friend's house, all those things. And then they get home and they let loose. And whether that is being more emotional, whether that's having outbursts, whether that's, fighting with their siblings, whether it's, all sorts of behavioral challenges. And that is also really common. And I think that's an important piece to highlight as well, as Dr. Hung was mentioning, of making sure that parents are taking care of themselves to be able to say, okay, my child, I'm creating this safe environment for them to be able to express their feelings and not have to just stuff it down. But it's also important for us as parents to be able to say, okay, I know that I'm going to try to not take this personally, or I know that I'm going to have my own coping strategies to be able to handle what's happening. So just wanted to highlight that as well.
Thank you. I'm going to go into some of the exercises and things that I will teach kids about, during some of my visits. We're going to be talking about progressive muscle relaxation, diaphragmatic breathing. There are Dr. Gordon is providing this patient handout with other resources. There's YouTube links to how to do some of these exercises at home with your kids. So, one intervention I love, progressive muscle relaxation. When we feel anxious, whether we realize it or not, our bodies tense up. We scrunch up, our shoulders are shrugged, our muscles are really tense. And kids do this and they don't realize that they're doing these things, but their posture changes so much. So the idea of progressive muscle relaxation is you get into a really tight, so you basically flex your muscles and then you relax, and then you kind of just try to understand how your body feels when it's in that really tense state versus a really relaxed state. So one example in one of the YouTube videos I recommend is squeezing a lemon. So I have, these kids, imagine you're squeezing a lemon with your hand as hard as you can. You want to get every last drop of lemon or lemon juice out. And then now I want you to, relax, open your hand. So having them kind of feel that difference of squeezing as hard as you can and then opening up, and just kind of, see what that feels like in your body to relax. And then another example of a relaxation you can do with your kiddo is pretending to be a turtle. So, imagine you're a turtle in your shell, you're safe at home, but then, oh no, there's a danger. There's a hare or a rabbit or snake or, something danger. And then, so you got to hide. So this is the shrugging your shoulders, So this kind of tenses your body up. And now you tell, okay, the danger is gone. And now just kind of open up and feel how relaxed you feel. So it's just getting them to realize what they feel like in their bodies.
Yeah, those are examples. It makes me think of a stress ball to where, like the lemon example. And so maybe if you have a child who is more of a hands-on learner, maybe having something like that to where it's like, okay, yes, you can squeeze this and then now let it go. And maybe when it opens back up, then we can take our breath and move on.
Mm-hmm. Yeah, that's a great one to have, but have the physical sensation there. Yes, for some kids who are hands-on, that's really helpful.
Yeah.
Diaphragmatic breathing, so deep breathing, is also really important for a younger kiddo. You do belly breaths. There's a YouTube video with Elmo that teaches you how to do deep belly breaths. And I think that lying down, comfortably on their bed is a great position. And I always have kids put something on their belly, so like their favorite stuffed animal, so that they can actually see the stuffed animal go up and down. And that's a visual that they are doing the deep belly breathing. Grounding techniques are really simple things you can incorporate. So kind of the analogy of staying grounded like a tree, just 5 seconds, plant your feet on the ground, spread them apart, stand up nice and tall and strong like a tree, maybe have your arms out, kind of like a power pose, and then breathe nice and slow, kind of like the wind. So that's literally grounding yourself to the earth. There's another one called 5 senses, where you just look for 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. So that's also, separating yourself from the moment of being really anxious, distracting yourself by other senses. So that would be another grounding technique. Coping boxes are, one of the handouts is going to be a coping box. So it's something that parents can make with their kids. You can literally take a shoe box or an old Amazon box and decorate the outside, paint it, add, stickers, whatever you want to it, and then fill it with things that, that will relax your kiddo or things that they like. It could be a picture, of their pet. It could be a picture of the parents. It can be like a stress ball. It can be some bubbles. It can be just whatever little things you have, maybe a mini stuffed animal, different textures, different plushy materials or soft materials, like in their coping box, that when things get really difficult, they can just whip it out and look at all the things that, that have positive associations. They have their box ready at any time.
So this kind of ties into what we talked about last workshop, was about positive parenting. So when we're seeing our kids becoming anxious or that they are getting ready to melt down or things like that, we can acknowledge what we're seeing. It looks like you're getting really frustrated, or I hear that you're really upset about that. Why don't we go grab your box? Let's go find something to play. It also kind of changes that scene or that redirection of those behaviors, kind of depending on the age. So it may not necessarily be appropriate for every age to do that. Maybe as they're older, they have this in their room and they can access it when they want it. But that can be something that if you're noticing it, all right, let's change the theme of how this is going.
I love that. Thank you so much for sharing that. And I looked at the handout that we're going to provide for everyone to see, and with some really awesome ideas. But I just have to share, this is good, not just for our kiddos, but for us. Like we all, as parents, we need a box like this. I was just thinking about like for Christmas, we all, or whatever, we had these boxes of gifts and that kind of stuff. And like, it's like short-term satisfaction, but how like cool would that be to have something like this to access all year long? Mm-hmm. And I've just noticed that when I get anxious, I have all these things that like I know, but I just forget about in the moment. And so having like a centralized place to be like, oh, remember there's a stress ball, or remember there's this essential oil or whatnot. Like, so that way you don't have to like keep it all in your brain in that moment, but like have these gentle reminders of, shoot, I have a ton of tools. So thank you for sharing that idea.
So I'll transition to talking about other things. And a lot of the resources I'm talking about right now are more suited for kind of younger kids, because of course we want to address it as early as possible. So a lot of the things I'm talking about kind of address that younger population, not so much the teenagers. The teenagers, there's some apps that I've had some teenagers use with success, which I'll talk about in a minute. I also like books and other activities too. So I wanted to share one of the books that it's called What to Do When You Worry Too Much, A Kid's Guide to Overcoming Anxiety. It's by a child psychologist named Dawn Hubner. So this is what the book looks like. And these are fairly inexpensive tools. I find this resource helpful. I feel as though it's written more towards like a 7-8-year-old. I think that would be the ideal population, although it's technically for 6 to 12. And it just, it's written in their language. And then she kind of compares having, too much worries as this tomato plant. If we overwater our tomato plant, it's going to grow bigger and bigger and bigger. So she uses these kind of age appropriate analogies and also has some techniques. It's also a workbook. So there's a page where you draw your worry monster. So actually putting visual to it. And then, setting a time aside for kind of like worry time. So there are strategies in here that I think is just very age appropriate. It's not for every child. I think for a lot of kids, I find this to be a really good starting resource. I encourage parents, if they do get it, to read through it themselves first so they know what's coming up and then give it to their kiddos. And then the kids might come to mom and dad for some questions throughout the workbook too. It's fairly inexpensive. I think it's like $10 or $12 on Amazon. And then another resource in regards to mindfulness and, how can we incorporate some of these activities to kind of day-to-day life, like make a game out of it, make it kind of fun. This is called Mindful Games. It's by Susan Greenland. And it's not really like games. It's definitely not a card game or a board game, but there are these activity cards that basically teach you mindfulness. So like this one is one of my favorites. It's called One Bite at a Time. So it tells you like what skill, they're trying to teach kids, what supplies you need. Like this one, you need grapes, blueberries, or raisins, appropriate for all ages. And then so leading the game is, it starts by just picking up the food and noticing how it feels, how it smells. Notice what you're thinking when you're holding onto the food, and then pop it in your mouth. And then don't swallow it. Don't chew it yet. Notice what it feels like on your tongue. Is your mouth watering as that, raisin is on your tongue? And then finally, you can chew it slowly and then swallow it. So again, this is kind of, teaches us to slow down, kind of reset, and just being more aware of our bodies. This one I also really like. It's called Appreciation Chain. So it's doing an activity, making appreciation chain. So these are there's like 50 activities in here that you could probably do on a rainy day. Whether you have a kid that's anxious or not, you can incorporate these things kind of day to day.
Love those. I have not heard of it. So I am definitely adding that to my cart.
Well, I already bought it, so thank you.
I love it.
And then I kind of mentioned apps for the teenagers. I know there's also all this stuff about screen time and not wanting them to even have a cell phone to begin with and limiting media use. But I think for a teenager to buy in, some apps I've found to be helpful and some apps that I used myself. Insight Timer, these are the free apps. Insight Timer, which is helpful for, doing some meditation, also helping for sleep. Headspace is another really common app. Calm, and then one called Lojong, Lojong. They're all teaching kids how to do mindfulness and meditation. And that's kind of where it's more age appropriate. Like, I don't think I can have a teenager buy in to do some of these mindful activity cards. But if you tell them like, hey, this app might be really useful, at least they might be willing to download it and check it out and maybe practice some of those activities.
Yep. Meeting them where they're at. We got to say, even though we want them to maybe do something different, like, oh, you have a phone? Here you go. Here's something to download. And they're usually like, oh, okay, let me go ahead and see what it is. So, yeah.
So next we'll talk about some on the supplement side. So, what are some pretty safe, gentle supplements that you could start, using for your kiddos? I'd already talked about magnesium for sleep. There's lots of different forms of magnesium as a supplement. I typically use citrate most commonly. There's a brand called Calm, 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 or Natural Calm.
Vitality.
By Natural Vitality. Yep. Comes as a powder or gummies. When you mix it in cold water, it fizzes, kind of like raspberry lemonade. And if kids don't like the fizz, you can just add warm water to it and it doesn't fizz. Citrate form of magnesium, think about the C, is also helpful for constipation. So if you have a kid that's not pooping every day, I think magnesium citrate would probably be the best form to use. Otherwise, there's also magnesium threonate, which I'll use in adolescents. There's some theory it crosses the blood-brain barrier better. There's other forms like glycinate, malate, various forms of magnesium. One supplement I've used on a lot of my kind of that 10 to 13 population is Lavella, which is lavender essential oil. And Dr. Gordon has it on her screen. That's what the supplement looks like. It's by Integrative Therapeutics. I love that supplement because there is actually a pretty good research study, a randomized placebo-controlled research study that compared that lavender supplement to lorazepam, like a low dose of a benzodiazepine, a pretty strong medication used in anxiety for adults. The study was done over a 6-week period and it actually had equal benefits. It was a significant difference and they did equally well. This lavender supplement supplement and the benzodiazepine medication. The only side effects I have found are maybe some, nausea, GI upset. Burping lavender is a side effect. So that could potentially be a good thing if you really like lavender. And then I do have some kids who they just don't like lavender. So that just might not be a good fit supplement wise.
Sorry, just to share this clinically, I feel like people either love it or dislike it. It's amazing how you just don't know. So I think it's definitely worth a try. But unfortunately, I'm in the don't love it category because it's burping up. At first, I have a burp or two of lavender, and I'm like, oh, this is nice. And then a while later, then I get angry about the burps, the lavender burps. So if you don't like lavender, listen to her other tools because
This is one I haven't tried, but we have a sample bottle from a different company that I just saw as I was pulling these off of our shelves. And I was like, I should try this. But then I didn't want to get distracted in the middle of the webinar of those exact things. But I'm going to try it and I'll report back on whether it's a good one or if I end up hating it, because I have a love-hate relationship with lavender.
So another supplement I'm going to touch on is also an herbal formula that does have a little bit of lavender, but it's not the main ingredient. It's the one Dr. Gordon is holding up. It's called Comerite Blisterite by Wise Woman Herbals. So it has some of those gentle nervines we already talked about, like lemon balm, passion flower, chamomile, catnip, California poppy, and a little bit of lavender. And it's also in a glycerin form, so there's no alcohol involved in it. And I've just had really good success using it on younger kiddos. It's helped them sleep a little bit better. It's helped them with their mild anxiety throughout the day. It's one of my favorite go-to supplements for younger kids.
Yep, mine too. This is one that is oftentimes my first go-to in kiddos, especially when they're transitioning either out of naps or they're going down from 2 nap down to 1 nap and they're just having a hard time falling asleep or they're more restless. So I will use this a lot, or teething if I'm not doing just Melissa or lemon balm by itself, but it's a really good one. Another one that you can add to even just some hot water or add to some tea or just drop it directly in their mouth. I like to mix some of these if they don't. This one doesn't taste bad. I've given it to my own kids. It used to have licorice in it and it was awful. They've taken that out and I haven't tried it on my kids since then, but they didn't mind it, but it's often one that I'll mix with something else. We've talked about elderberry syrup in the past, and that is just such a great vessel for all sorts of different things. So if your kids don't like the taste of it, mix it into something else. And then oftentimes it is more palatable or more tolerated. But yeah, those are some good ones. And I'm glad I had some examples of that. I'm going to share a couple of my favorite ones too. And some of them we've already talked a little bit about. So I'm just going to re-highlight Rescue Remedy. They make this it is Bach flower essences. They make the adult one that is an alcohol extraction. And so if somebody is sensitive to alcohol or can't have it for whatever reason, then don't use the regular ones. The kids one, I believe, is alcohol free. I was just double checking. I don't know if this one is or not. It's not enough that I'd be worried about it if it's not. And then they also make it in the little lozenges or pastels. There's another one that I like called L-theanine. So L-theanine is an active ingredient in green tea. So either for adolescents or adults, will oftentimes to tell them to drink more green tea and then to reuse their tea bag. So rather than just throwing it out after the first time, and good tea enthusiasts will tell you don't do that because that's the bad thing to do. But when you keep using that tea bag, you're going to extract more of that L-theanine that's in there, or things like matcha are going to have higher amounts. And so L-theanine is useful for anxiety because it helps to modulate serotonin and GABA. So it can be very calming. So another way that I'll use it for kids is there's a brand, and I don't have an example of this, but it is called Good Day Chocolates. So kids obviously love them because they're little tiny chocolates. They're made with fair trade. I don't think it's organic, but it's at least fair trade chocolate. And it has chamomile, which can be very calming, and then also theanine. So I've used this on my youngest, TM, and sometimes she'll come up to me and she'll go, Mom, I feel like I need a chocolate. And it's not because, could be because she just wants a piece of chocolate, but she oftentimes will start to recognize when she's getting frustrated or worked up about something. And so it can be useful. Again, you could put it potentially in a lunchbox, depending on the age. But I really like those as long as you can tolerate dairy because it does have milk in it.
Designs for Health also makes their chocolate now.
Yes.
So that's a good theanine GABA chocolate combo.
Mm-hmm.
We have it at our front desk too.
Yeah, I got a chance to try it for the first time when I was in San Diego a couple of weeks ago for our workshop, and they're tasty. I like that one because it's dark chocolate too. So that's a good one. I'll have to order some so that way Dr. Hung can try it too. Another one is going to be glycine. So especially when we're talking about difficulty sleeping, maybe magnesium wasn't enough by itself, I'll oftentimes pair glycine with magnesium because it can, or I'll use it, put it in chamomile tea. Lower doses, I usually do about 500 milligrams for more adolescents. They used to have these little glycine straws. I don't know if they carry them anymore. I'll post them on the Facebook page if I can find the link to it through our full script. But it can be used either with magnesium or it can be added to the chamomile tea. In adults, I will use a higher dose. I'll do up to maybe 2 grams for an acute panic attack, and that can be beneficial. I haven't done it a ton with adolescents, but I use it a lot when it comes to sleep. Dr. Hung already highlighted some of our herbal nervines. So these can be used in teas, in tinctures, glycerites. Sometimes we'll also do herbal adaptogens. So adaptogens are going to help our body to process and manage that stress more appropriately. So my favorite, especially for adolescents, is ashwagandha. I'll use somewhere between 100 to 150 milligrams, and it comes in gummies as well as in capsules. And so that can be a great one, especially if they're having a harder time with focus or concentration or just getting overwhelmed. That one can be really beneficial. It's not an anti-anxiety per se. It is just, it helps us to adapt a little bit better.
Who makes those gummies? I've never had an ashwagandha gummy.
Yeah. So Goli is a common brand, GOA. They're the ones that also make the apple cider vinegar gummies. There's another brand that makes I think Vital Proteins just started making an ashwagandha gummy too.
Okay. Yeah, and everyone has access to Fullscript too, so they can take a look. That's the nice thing. They have a good search function, and I'm always seeing new things. I'm like, oh, this is awesome.
Yeah. Maybe we should even do create a Nourish. Yeah. We'll chat about that later. Another herb that I like is holy basil. So this is another one that I do often in tea form. So Tulsi tea, that I do a ton for both adults as well as for older kids. Not that I won't do it for younger kids. Rhodiola is one I'll usually do in capsule form, more for adolescents or adults. And then Eleutherococcus, that one I use that one more if you need a little bit more of a boost versus needing to be more calmed. And then the last one that I wanted to highlight is 5-HTP. So actually here's two. This one is an example of the L-theanine. So it's one of my favorites. It has GABA and L-theanine. So Dr. Stewart was mentioning those chocolates by a company called Designs for Health. This one's by a company called Allergy Research, and it's just a capsule form. And so I will use this in adolescents as well as adults. And I will 1 to 2 capsules. Sometimes I'll do a little bit more. The reason I bring 5-HTP up is because this one can be helpful with anxiety when there is more OCD-like tendencies, especially to help with falling asleep before bed. Sometimes I'll use it in the morning to be helpful for kind of mood uplifting, but it can be calm, not sedating, but it can make some individuals a little bit more sleepy. But you do have to be a little bit more careful with 5-HTP in regards to, I find that not everybody or adolescents don't tolerate it as well. Side effect, or as Dr. Hung was mentioning, it's just really important to know that with anything, there can be side effects. And so the ones when it comes to melatonin that Dr. Hung brought up previously is, while sleep is so important and generally melatonin is really safe, we do have to keep an eye out for nightmares because then that can create a negative association with sleep and things like that. So yeah, few of my favorites. I think I highlighted I didn't. Last one. So passion flower. So this is one of the other herbs that can be really helpful for acute anxiety too. So if you're feeling like you're on the verge of breaking down or test anxiety, things like that. So this one is a glycerite. So I use this one quite often. Again, just it tastes good. So you can take it directly or you can add it into tea, but lots of great options that aren't necessarily medications, but there is always a time and a place for medication. So I'm going to let Dr. Hung kind of talk about that next.
Actually, before we jump to that too, I'm interested because the two of you see a lot of pediatrics. What has your experience been with CBD?
So I'll give you my disclaimer and then Dr. Han can highlight it. Because at least my malpractice insurance has a restriction that is not something that I recommend or prescribe simply because of, gotta love all the, restrictions. And so it is something that is used more frequently, but it's not something that I will recommend clinically. There's just so much information that's out there and trying to navigate the different strains and things that I'm not well versed in it. So full disclosure, it's not something that I recommend, not necessarily because I don't believe it can be safe and beneficial, just because it's something that there's limitations in my scope with my malpractice that I just choose to kind of stay away.
Yep, I will say that really similar. I mean, we use the same malpractice insurer, myself and Dr. Gordon. So I can't say like, I recommend this as a treatment for your child with anxiety. But I will say I work, with a lot of kids on the ASD spectrum, and parents will, just use, CBD oil for either sleep or for anxiety or some behavioral issues. I've heard mixed in terms of, I've heard the positives that it could be helpful in some situations. And I've also heard of it really not making much of a difference. It seems to be relatively safe from what I've spoken with parents and how they're using it. So that's the extent of what I can contribute to that.
Yeah, I think maybe I've just been in California too long. I'm like, well, yeah. No, I think that I've just seen that clinically as well, is that it either works beautifully or it doesn't really. I think that thankfully it's been very safe, especially you can get a lot of things now that doesn't have any or much THC, so you're not having that effect. But yeah, I think that, for my patients, I would generally say, totally worthwhile of trying. And if it works, stay with it. And if not, I think that, there could be other brands, there could be, different dosing and so forth. But there's definitely those out there that's, I would say, experts in the field if it's not working, and maybe we could, fine tune it. But I don't have,
I just wanted to ask, so you a few of those that y'all mentioned, you recommended using before, that there may be a trigger or stressful situation somewhere for after, and you don't necessarily have to do that now, but would you mind maybe listing those in some resource that we could have? Or I guess if we can't do it that way, if you don't mind running through them, because I'd like to know what would be in my toolbox to give to my daughter, ahead of time as well, versus which would be better after.
Yeah. Dr. Hung, do you want to go first or do you want me to
Go ahead.
So I think that when it comes to preventative ones, so Tina, remind us how old she is. Oh,
I think she's trying to say 8. She's on mute right now. But 8.
So I don't know, and Dr. Hung, you can correct me if you have a feeling differently. I have not used Lavella in an 8-year-old, even if they're really tiny. So it's like the size of less than like an M&M. So they're not huge. I have not used it in an 8-year-old. Have you?
I have not. The youngest I've used, I think, is like 10 or 11.
Yeah. So if it were something that were happening on a more regular basis, then I think that I would feel comfortable doing Lavella as like a preventative. If it is more situational, like it's only happening, with tests or something that is, coming up, like that they're anxious or worried about or uncertain about, then that's when I would either do the rescue remedy either before or after, or I would do any of the glycerites that we talked about. And these can be done, before or after. So the Calmerite glycerite, especially that morning. So if it's something that, in the days leading up to it, you could do that as all right, we know that we're going to have some of these feelings. And then if it were solely tummy aches after the fact, like after the stressor, I would probably do Melissa as my main go-to.
Then you also had the passion flower glycerite that you had shown too.
Yep, those 3: passion flower, Calmerite, and Melissa.
And then the chocolates, just to, and then the Zen.
Zen, I don't know if I do for her age.
Yeah, I know. I was going to say that was going to be why.
Yeah. No, I would hold off and do some older.
Yeah. Generally, for some of those like neurotransmitter precursors, I don't think I've ever used those in anyone under the age of 12. So I always use herbs first with that younger population.
I agree. Is that helpful, Tina? Yeah. Perfect.
So we are not going to discuss the details when it comes to medications. I think it's important to just have that brief conversation that yes, there is a time and place for medications. I have teens who we've done everything. They've done therapy, they've tried lots of herbs and supplements, and their anxiety was just to the point we needed to start medication. And I think having those open conversations when we start any treatment is for them to feel like there are also other options, that this isn't the end all be all. And then it's also important to have that informed, consent and just knowing all the potential side effects of medications. So what we know about like the etiology of anxiety, it stems from something called the monoamine hypothesis of neurotransmitters. It's kind of a theory for depression, in that there's an imbalance in certain neurotransmitters in the brain. There's not enough serotonin or norepinephrine or dopamine. And this theory has been around like 50 to 60 years. So we are still using medications based on research from 50 years ago. So there's still, I feel as though, so many things we don't know. And Dr. Gordon is going to talk about more the gene site, a little bit of the genetics, giving us a clue when it comes to optimizing if we do need to use medications. But typically we use SF as a first line for children, that in sertraline, duloxetine and fluoxetine. The brand names are Prozac and Zoloft. It's important to know, if you do discuss starting medications with your primary care provider, the potential side effects. And the number one being, it can increase anxiety. It can actually worsen your child's mood. So just being very transparent about, yes, there's the GI side effects like the nausea, abdominal pain, there's dizziness, there's headache, there's insomnia, not being able to go to sleep, and also really being mindful that it can worsen their mood. So it's just this transparency that parents should be given all the information before starting any treatment.
And can you mention the black box warning too?
Yep, that's exactly what I was going to say. All of them come with that black box warning of, as Dr. Hung was mentioning, that it can worsen symptoms. And so being really mindful of suicide and having those open conversations with our kids, if we are putting them on medications, of I want to make sure that you have these safety strategies in place. If you are feeling like you are not getting better, making sure that they have a suicide hotline number present, that they have a safe adult that they can turn to, and knowing that that is a potential both for the parent. So that way, maybe they're starting a medication on a weekend where they can keep a closer eye. They're not going over to a friend's house or those types of things. I think those are really important to acknowledge.
And also with the medications we use for depression and for anxiety, they're the same. So it's not like we have special medications for one or the other. And yes, because depression is often such a common comorbidity with anxiety, in our office, when we have a kiddo who is anxious, also has depression, we have a safety plan. So like Dr. Gordon mentioned, we have these coping strategies, we have phone numbers, we have our office phone number. If the child has a therapist, that their phone number is listed. And then strategies like if they get to a certain point where they, are suicidal, then knowing which emergency room to go to, or yes, having the teen suicide hotline available. They need to have that plan laid on a piece of paper if it comes to that.
Yeah. So one of the tools that I'll oftentimes use is it's a genetic test. So it's called GeneSight. I guess it's backwards on that. So GeneSight is not backwards, just on my side. Okay.
Yeah.
So what I love about this test is that it's not a blood test. So even if the kiddos are really apprehensive about doing labs, we have a way. Everything you need is in this little envelope. It is just a cheek swab. So you take these 2 Q-tips, you're going to do a cheek swab or from both sides, you mail it off to the company, and then the provider gets about 2 to 3 weeks or gets results within about 2 to 3 weeks. It is billable to insurance, but it can be expensive. But this particular company, and there's numerous companies that are out there, this is just a common one that we will use here in our office. Generally, I think it's $300 to $330 is kind of their maximum. What we use it for is either if you have a family who is interested in starting medication, but wants to have a little bit of clarity on how the role of genetics can play a part in how we might choose a medication, because there are certain genes that can tell us, will you have a potential for increased side effects? Will you need more or less than a typical starting dose based off of how well your body metabolizes that medication? And so it can be really useful for either the initiation of medications, or if somebody is having some side effects or they're not responding to it and we've already tried 1 or 2 and we're trying to figure out, well, where do we go next? It can be a really useful tool to be able to say, okay, now we know this category of medications your body might not respond as well to, or wow, the reason you're not improving is because you metabolize it really quickly. We need to increase your dose. So it can give us some of that insight. And I think it can be really useful. And as a parent, sometimes it can be really comforting to be able to say, not the end all be all, as a tool, as a part of this decision making, it can give us some additional information to help us feel like we can make the best decision for our kids.
That's honestly a really good price. We've used tons of different genetic companies over the years, and they've been in the thousands. So I haven't seen a trend of
for max. If they're paying cash, it's like $1,200 to $2,100, I think.
Oh, so if they have insurance, that's then the max if they have insurance. Do you know, is that HMO or PPO?
I don't. But what I love about this company is that they have like a transparency guarantee and I don't have any affiliations with them at all, but they will call the family if this test, after they do their insurance verification, if it's going to cost more than that, then they won't run the test until they have gotten authorization. And so I love that it's just transparent because genetic testing can be really expensive. And the other big thing to know is that once you have something like this done, you don't need to do it again. Our genes don't change. And so you can get, and it's not just anti-anxiety medication or antidepressant medication. It now includes like ADHD medication, other panels, and I don't remember off the top of my head if this one does, but it'll give us other certain categories of medications. And will even give us a little thing to put in your wallet to say, if you have these potential genetic markers, you might need to hand it to somebody if you're going to have surgery or keep it in your wallet as a precaution. So it can give us really useful information.
You've inspired me to go do some price comparisons at work because we have one called Mindful DNA that is similar, but I think it's more expensive. I don't know. I'll do a little research and report back.
Yeah. There's another one that we use, or two other ones that we will use. One of them is called Tempus, and that one is similar. They're still cheek swab. And then the other one is Empire City Labs. That is a combination of both blood as well as the genetic component for looking at nutrients, hormones, other sorts of things. And I do that one quite often when it comes to adolescents because it gives us so much information, including the genetic piece.
Cool. Thanks.
Yeah. Dr. Hum, you mentioned briefly in regards to when, as a part of like a plan, if we're having discussions about medications and counseling, will you briefly touch about counseling and kind of the differences and things that are important to note for parents?
Mm-hmm. So finding a therapist or a counselor can be super challenging because of insurance being the biggest one and availability. And some of the best counselors and therapists, they don't take insurance. So yeah, cost is going to be a huge barrier. I mean, you can definitely contact your insurance for that list of preferred providers, but like our office, we have a list of all the providers in the area who offer certain therapies. For younger kids, if I'm thinking about a 3 or 4-year-old that has anxiety, what type of therapy is available? It's not, one-on-one talk therapy. That's not going to work. And, it's either play therapy or art therapy, even music therapy. So typically it's done by a licensed mental health counselor or a licensed mental therapist. Kind of the difference is just the level of education. So, right, getting a master's degree versus having a doctorate or a PhD. So, psychologists that Dr. Gordon mentioned, psychiatrists, they do those comprehensive evaluations. Psychiatrists also manage complex medications. In terms of talking about the therapy aspect, some psychologists do therapy, not a ton. You're really going to look for a licensed mental health counselor or licensed mental health therapist. And they typically have like a master's degree and also specialize working with kids. So I think art therapy and play therapy are amazing for that younger population, like 3 to 6. It's not that they're just in a room playing with lots of different toys. The therapist is seeing how they interact, how they draw, how they color, how do they include the therapist, as part of the interaction. And we learn so much by watching a child play and also facilitating that interaction. The kids are in charge of the situation, they're in power. And then how can the therapist, create that empathetic relationship with them to help them, have the coping strategies to be in charge of the play therapy. So I think it's great for younger kids. And yes, just talking with your primary care provider about, the resources to people who do that type of service.
Yeah, thank you. And I think the biggest thing is finding the right fit. Mm-hmm. If just like with, a healthcare provider, just like with anything, making sure that even if the first time it didn't go according to plan, not just writing it off entirely, or maybe saying, hey, that wasn't right for right now. Let me come back to this. But you really do have to find the right person because otherwise you're not going to want, or our kids aren't going to want to open up to them or things like that. So really important.
Yeah,
but it's really tricky to find the resources, especially right now. So just keep asking friends, asking your healthcare provider, Facebook groups, all sorts of things just for recommendations.
Mm-hmm. And just going back to how important it is to find the right fit, we have one of the therapists that we recommend for counseling, and then she actually is partially faith-based. So a lot of my patients who do, they pray, they are Catholic, they go to church, like she's a really, really good fit for them. So it's all about exactly finding the perfect fit. She's not a good fit for a lot of patients, but for some of my patients, she is the perfect fit.
Yep. Mm-hmm. Yep. Okay. And then for sake of time, I know we only have just a few more minutes here. Will you just talk about a couple of the other recommendations? And then I have a member question from somebody who wasn't able to attend, and then I want to make sure we get answered.
Yep. So, other therapies or other things that you can ask your primary care provider for, I want to bring up an emotional support animal or having a service dog. I need a letter of medical necessity from your provider. So your primary care provider or the psychologist or psychiatrist if they did that comprehensive testing, they would be the ones to provide that letter. And there are associations, within your state that will, offer basically service animals that I have found to be really helpful for some of my teenage adolescent patients. I haven't used it actually on younger kiddos as much. Aromatherapy, so just using essential oils, considering just having a diffuser with lavender. I keep bringing back lavender because one of my favorite herbs, but I know kind of has mixed feelings with other people. Biofeedback, some of the on the resource page that we'll have is talking about what biofeedback is. Our children's hospital offers biofeedback, but surprisingly not for anxiety. There's like 4 specific conditions they do biofeedback for. Anxiety, unfortunately, is not one of them. It's basically targeting, like what it looks like is these kids are hooked to these monitors to monitor their body temperature, their heart rate, and their pattern of breathing. And it's teaching these strategies, kind of like some of those mindfulness techniques we talked about. Their thoughts can change everything from how warm or cold their fingers feel to how fast their heart is beating, to like the variation in how they take a breath. So it's so cool to see like your thoughts and that kind of emotional physiological connection. That's what biofeedback is. We're lucky we do have a provider in our office that provides biofeedback as a service. That's definitely, I think, a very valuable tool and a therapy that some practitioners offer.
And what's interesting, going back to the emotional support animal, 2 to 3 years ago, 2 of my kiddos, their elementary school brought on a support dog as a part of their counseling room. So it is the counselor's dog, and she actually got the dog certified as a support animal and brings it to school. So that way, if kids are in the counseling room and they're struggling with something, that she can use that as a part of her tools. Fortunately, my son's not allowed to use it because he has an allergy to dog, but it's been a really useful thing. And so they always include it in part of the counselor's corner in terms of their newsletters. But it's something that can be really beneficial for some people. But I thought it was kind of fun that the school is starting to incorporate some of those things. Okay. Any questions about any of that before I open it up to one of our questions from our parent member that wasn't able to attend today? Okay. So one of the questions, so this particular person wanted to know more about how to speak to an anxious kiddo who is a perfectionist. What are your thoughts, Dr. Hung?
This makes me think of, it's that line of thinking. So there's another resource, which I don't know if I included, but it's actually from Anxiety Canada. That's actually like the link. There are lots of, and this might not directly answer the question, but they have these kind of like worksheets for teenagers and for like one of them is literally titled Healthy Thinking for Younger Children, where if we have like a specific thought, like I need to get 100% on every single test, or, otherwise, I'm a failure, having these lines of thinking. So what are your anxious thoughts? How does that make you feel? What is the behavior? Like, what does that make you do? Does it make you stress out? Does it cause those physical symptoms that we're talking about? A lot of it is just self-talk. So that's where cognitive behavioral therapy is kind of one of those tools that counselors and therapists use. And it's about reframing the way that we think. Some people are naturally having more pessimistic thoughts. How can we reshape that thinking into more positive thinking? Like if I don't get 100% on every single test, am I actually going to fail out of school? No. So it's just kind of teaching younger kids or older kids about self-talk and positive thoughts and actually writing those thoughts down. Like what is the behavior that comes with it? What are the feelings and emotions? And what is the logic? What's actually going to happen? Kind of using that logical side of the brain more. So I think Anxiety Canada has some of those like documents and resources for talking with kids about that. Hopefully that helps.
Yeah. A part of me is like, I want to keep going, but I would say stay tuned because that's definitely going to be an additional conversation because I think it's really common to have those struggles.
The only thing that I want to add to that before we wrap up is that sometimes as parents, we want to fix it. We want to offer the like, oh, but that's not true. Or why would you think that way? Or those types of things. And oftentimes, especially individuals or kiddos who have those thoughts, just even saying it sometimes is really hard. And so I would encourage parents to listen, to maybe ask open-ended questions, to give that opportunity to be able to express the why about it. But I also think it's really important to acknowledge what Dr. Hung was pointing out of like, is this likely? Like, if you fail the test, are you going to fail out of high school? No. So that way we can kind of break some of those things down. But I think just listening sometimes is the best thing that we can do versus just the language in which we are speaking to a kiddo with perfectionism. Yes.
All right, guys.
All right. Well, thank you for your time. Thank you, Dr. Hung. I appreciate it.
Oh, of course. Thank you, ladies.